This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
One of the things that I occasionally get asked is, what's the best IVF specialist? Obviously, I would say me, but it's not necessarily the case. A best specialist is someone who fits your requirements, and that's not universal, that one doctor is not necessarily good for one patient or another. You've got to be able to have a doctor, a specialist who you can communicate with, who you feel comfortable with, because going through fertility treatment is a long journey. And along that journey, you want someone that you can relate to. I suppose the first thing is to find someone who you can relate to. I don't think there's any best fertility specialist. In terms of basic fertility treatment, there are many doctors out there that can do the same things again and again and again and get reasonable results. When you start to get into situations where things aren't happening, then it is important to find a specialist who is more than just a gynecologist with an interest in infertility. There is in Australia a training program for what we call subspecialists. That sounds a bit derogatory, and sub suggests we're not as good. But in fact, it's highly specialised. So these highly specialised doctors hold a qualification called the Certification in Reproductive Endocrinology and Infertility. You'll see on the end of there a set of letters CREI. And around Australia, there are about 75 of these highly trained, 3 years extra training to their basic gynecological training doctors. That 3 years of extra training extends way beyond just simple IVF. It covers training in genetics, training in male factor problems. I mean, one of the problems with a generalist, you have a male problem. They've never had any training in what to do to see how they can improve sperm counts, to actually investigate properly men with low sperm counts. And there are many opportunities to improve that situation. But if you go to a generalist, they'll just say, oh, you need IVF with ICSI. But maybe you don't. So seeing someone who actually has been trained in that area is very important. In terms of ranking best, good, better, best, someone with the CREI certainly must place them in that top best group. The other part is obviously their success rates, but in fact, doctors, specialists don't really determine their success rate. It's the laboratory and the service that determines success. Far more than me getting the protocol that is right for you, far more than me being able to collect eggs, far more than me being able to transfer eggs. It's the laboratory behind it that produces the good results. Good doctors certainly the best out of their laboratory, but it ultimately is a laboratory. In terms of consistency, the big clinics do have an advantage over the small clinics. There's no doubt about that. Statistically, that's true. That clinics doing 500 or more cycles do better than those doing 100 or 200 cycles. In terms of best, I also believe that the ultimate goal when a patient comes to me with infertility is for them to go away satisfied. Now, satisfied, obviously, if you get a baby, is great. For many of our patients, particularly those over the age of 40, even with the best, there are going to be a lot of patients who go away without a baby. But that doesn't mean they're not satisfied. They in a good clinic with the best specialist, will go away knowing they've done everything possible to have a baby. Unfortunately, it hasn't been successful. And I certainly get as much satisfaction from patients saying, thank you for the care you've given me. I accept that I'm not going to get pregnant, as much as a crying baby at the end of the day. Good specialists, the best specialists, certainly care for their patients, whether they're successful or not. And even that's particularly the case in older women. I'm more than comfortable treating women 44, 45 years of age, as long as they're realistic about what they're going into, and ultimately knowing their chances of success are incredibly low. But they and I know that they want in 10 years' time to look back and say they've done everything possible. So what's the best specialist? Well, mostly your GP will know who the local good people are. But even then, I would be specific. If you're talking to your GP about getting a referral, ask for a specialist that's got the subspecialty qualification, the CREI. It's a big start to getting you in the right direction, getting you pregnant as fast as possible.
And don't forget that you can access all the previous episodes by going to our website, www.theivfjourney.com, and select IVF Journey podcast from the navigation menu.